And when we talk about heart attacks, most of the conversation stops at survival. Did the person make it? Was the damage severe? What treatment was used? But very little attention is given to what happens after. And I would argue that what comes next after the heart attack is just as important, if not more so, than the moment it strikes. Because once the dust settles, once the immediate danger passes, we're left with a choice. That choice is, do we return to old patterns and habits that brought us to the edge, or do we rewrite the script? Physically, the heart is remarkable. It can endure trauma and still keep beating. But it doesn't just need to keep beating, it needs to heal. And healing is not passive. It requires active engagement with your lifestyle, with your medical care, with your emotional health. When a section of the heart muscle dies from lack of oxygen, scar tissue forms. This tissue, unlike healthy muscle, can't contract or conduct electricity well. That means the rest of your heart has to work harder to keep up. And while medications and procedures can support that effort, they're not a substitute for transformation. They're tools, but you are the architect. What's often overlooked in recovery is how deeply psychological this process becomes. After a heart attack, many people experience fear, anxiety, even depression. That's not weakness. It's the nervous system processing a life-threatening event. There's a trauma response. You may start to question your body, mistrust your own heartbeat, feel a loss of control. That is completely natural. But if we don't name it and navigate it, we risk staying stuck in survival mode even after the event has passed. This is why cardiac rehabilitation is so important. And not just the treadmill or the dietary workshops, I'm talking about the mindset work. A heart attack can be your body's most painful wake-up call, but it can also be the moment you finally begin to truly listen. You begin to see stress not just as a mental strain, but as a physical poison. You start to appreciate how food can be medicine or a slow toxin depending on what's on your plate. You start noticing what and who takes your energy, and you begin to make different choices. And speaking of choices, let's talk about prevention, because the best way to heal after a heart attack isn't just to patch the damage, it's to ensure it doesn't happen again. Statistically, once you've had a heart attack, your risk of another one goes up significantly. But that's not the end of the story. Studies have shown that patients who fully commit to lifestyle changes, daily movement, clean eating, adequate sleep, meaningful connection, and spiritual or meditative practices can actually reverse some of the underlying causes of their heart disease. Yes, reverse. The human body is adaptive, regenerative, and far more intelligent than we give it credit for. There's also a deeper layer here that goes beyond biology. A heart attack can be a spiritual rupture. It can force you to ask, what am I doing with my time? Who am I living for? Am I chasing something that doesn't fulfill me? The heart, metaphorically and literally, is the center of our emotional life. It's where we hold grief, love, anxiety, and hope. When it breaks down, it's not just a physical failure. It's often a symptom of a life out of balance. So the healing process isn't just about exercise and medication compliance. It's about finding alignment. When you align your lifestyle with what truly nourishes your heart, foods rich in life, relationships rooted in love, moments filled with presence, you create an environment where healing becomes sustainable. And sustainable healing is the only kind that lasts. Let me offer this to anyone who's faced a heart attack or loves someone who has. This isn't the end of your story. It might be the beginning of a more honest one where you learn to live deliberately, where your days are shaped by clarity rather than chaos, where your body is no longer your enemy but your ally. You don't have to be perfect. You just have to be willing to slow down, willing to pay attention, willing to rebuild not just your heart, but your life around what truly matters. The heart remembers. It holds trauma, but it also holds power. And when you choose to heal with intention, you don't just recover, you rise. Let's take a moment to talk about something invisible, something you can't see, can't feel, and often don't even know is happening until the damage is done. I'm referring to the slow, silent buildup of plaque inside your arteries. It sounds benign, doesn't it? The word plaque feels almost familiar, like something you brush off your teeth. But when it's lining the walls of your arteries, it becomes something entirely different. It becomes the fuse on a ticking time bomb. This process has a name, atherosclerosis. It begins quietly. Tiny irritations in the inner lining of your arteries triggered by things like high blood pressure, smoking, processed food, or even chronic stress create microscopic wounds. Your body, in its attempt to repair those wounds, sends in cholesterol, white blood cells, and inflammatory proteins. The intention is healing, but the result over time is a thickening wall of plaque made of fat, calcium, and cellular debris. It's your own biology trying to help, but doing harm instead. Now here's the truth most people don't realize. A heart attack doesn't begin with the first sharp pain in the chest. It begins years, sometimes decades before that. By the time symptoms appear, the disease has already been brewing beneath the surface, slowly narrowing those vessels that feed your heart muscle. It's the ultimate betrayal of our biology's good intentions. And the most dangerous plaques? They're not the ones that are big and bulky. They're the ones that are unstable, thin-walled, inflamed, and prone to rupture. Imagine a volcano that looks calm from the outside but is seething inside. One rupture, one release of that inner chaos, and the body scrambles to patch the damage. A blood clot forms. That clot, now blocking an already narrowed artery, cuts off blood flow, and just like that, part of your heart begins to die. This isn't about fear, it's about understanding. Because when we understand how a heart attack builds over time, we begin to realize that prevention isn't about luck. It's about patterns. It's about our daily decisions, the way we eat, the way we move, the way we handle emotional pain, even how we sleep. All of those choices either quiet the fire of inflammation or fan its flames. Think about the foods we eat. A diet high in refined carbohydrates, sugary snacks, and trans fats doesn't just add inches to the waistline, it feeds inflammation. It promotes the very processes that damage your arteries. And it's not just about cholesterol levels, it's about what your body does in response to those levels. A person with high LDL cholesterol but low inflammation may be at less risk than someone with moderate cholesterol but high inflammation. That's the missing nuance in so much of the mainstream conversation. But let's also talk about stress, because this isn't just a psychological issue, it's a biological one. Chronic stress raises cortisol, elevates blood pressure, and increases blood sugar. It puts your body in a constant state of fight or flight. And when you're always in survival mode, your arteries pay the price. You're literally shaping your vascular system with your emotional responses. That's a sobering thought, and also an empowering one, because if your emotions can harm, they can also heal. The good news is that plaque doesn't have to be permanent. The body has an extraordinary capacity for repair if we give it the right conditions. Fiber-rich foods, antioxidants, omega-3 fatty acids, regular exercise, restful sleep, and stress reduction can stabilize plaques, reduce inflammation, and improve blood flow. Even small changes done consistently can begin to reverse the damage. What I'm suggesting is a shift in perspective. Instead of waiting for symptoms and reacting in crisis, we need to start treating every day like a vote for or against our future health. We can either live in denial, believing that a heart attack is something that happens to other people, or we can take responsibility now while we still have the power to prevent rather than just survive. And this isn't just about biology. There's a deeper question here, one that speaks to the philosophical heart of health. What are you building inside yourself when no one else is watching? Because that's what plaque is. It's the sum total of thousands of unexamined choices. It's the physical imprint of a lifestyle that needs to be seen, acknowledged, and transformed. So the next time you reach for that sugary snack, skip your walk, or bottle up your anger, ask yourself, is this feeding inflammation? Is this helping my heart or hurting it silently? The silent buildup of plaque is a story your body writes over time, but you hold the pen. Every day, every decision is a line in that story. Now is a perfect moment to rewrite the ending. Let's zoom in for a moment, not on the heart, but on what fuels it. Blood, that seemingly simple red liquid flowing through your veins, is, in fact, your body's most vital delivery system. And during a heart attack, it becomes the very thing your body can't get enough of, at least not where it's needed most. This is where the conversation gets interesting, because understanding what happens inside your bloodstream during a heart attack is the key to preventing one in the first place. Picture this: your heart is pumping away about once every second, circulating roughly 2,000 gallons of blood a day. That blood carries oxygen, nutrients, hormones, all the building blocks of life. Now imagine that flow being choked off. Not slowly, not gradually, but suddenly. One moment, the cells in your heart are getting what they need. The next, they're starving. That's a heart attack. It's not about the heart failing to do its job. It's about being cut off from the very substance that allows it to function. Infection, the culprit, is usually a blood clot, but the conditions that create that clot are already in place. Plaque buildup, as we talked about, plus one more critical factor, the quality of the blood itself. This is often ignored in mainstream discussions. We focus on arteries, cholesterol, even the electrical system of the heart, but rarely do we ask, what is the state of the blood flowing through these vessels? Blood is more than a transport system. It's a reflection of your internal terrain. Is your blood thick with sugar, inflammatory markers? Is it sluggish with impaired circulation, or thin, vibrant, and efficient? These are not abstract questions. They determine whether your heart muscle survives or suffers during a crisis. Let's take high blood sugar as an example. Elevated glucose doesn't just harm nerves or lead to diabetes. It damages the delicate endothelial lining of your arteries. It makes your blood more sticky, encouraging clot formation. It changes the chemistry of the blood in ways that promote inflammation and oxidative stress. This is why people with diabetes are at significantly higher risk of heart attacks, not just because of what sugar does to the body over time, but because of how it alters the blood in real time. And then there's oxygen. Blood is supposed to carry oxygen like a well-organized courier system. But if you're sedentary, under-oxygenated, or dealing with chronic stress that impairs breathing and circulation, your tissues, including your heart, aren't getting the oxygen they need. The heart is a muscle. And like any muscle, it fatigues, it suffocates, it fails without proper oxygen delivery. When oxygen can't reach damaged areas fast enough during a heart attack, the damage becomes permanent. Here's something even more fascinating. During a heart attack, there's a massive biochemical storm inside your bloodstream. Your body releases adrenaline. Your platelets become hyperactive, rushing to form clots. Inflammation spikes. Electrical signals become chaotic. It's a system-wide alarm going off. And yet, your recovery or your survival often depends on how resilient your blood is in that moment. That resilience is built long before the emergency begins. This is where lifestyle becomes a life or death matter. Think of hydration. Simple, right? Yet so many people are chronically dehydrated. Blood volume decreases, blood thickens, circulation suffers. Or look at sleep. Sleep regulates blood pressure, cortisol levels, and even blood viscosity. Poor sleep quality leads to a cascade of physiological changes that make your blood less efficient and your heart more vulnerable. Even emotions impact your blood. Anger, fear, unresolved grief. These aren't just felt in the mind. They alter your physiology. Acute stress can cause blood vessels to constrict and clotting factors to spike, creating the perfect storm for a heart attack. And all the while, your blood is carrying the imprint of these emotions chemically, hormonally, electrically. The message here isn't fear, it's awareness. The body doesn't lie. It tells us through symptoms, signs, lab results, even moods, what's going on beneath the surface. Your blood holds that story silently until one day it becomes loud enough to stop the heart. But it doesn't have to reach that point. You have far more influence over the quality of your blood than you think through clean nutrition, rich in leafy greens, healthy fats, antioxidants. You thin the blood, improve flow, reduce inflammation. Through daily movement, you oxygenate it. Through meditation, you calm the stress response that clogs it. Through connection and joy, you create a hormonal environment that nourishes it. So when we talk about heart attacks, we have to stop seeing them as sudden, random events. They are the logical outcome of long-term patterns, and those patterns leave their trail in the bloodstream. Your blood is not just a fluid, it's a message. The question is, what is it trying to tell you? And are you ready to listen before your heart is forced to scream? Let's move beyond the blood now and focus on the silent scream your heart makes during a heart attack. A scream that often goes unrecognized until it's too late. This is where we need to talk about symptoms. And not just the textbook symptoms, the ones we've all heard 100 times. I'm talking about the real signals, those nuanced, sometimes subtle cues your body gives you that many people overlook, dismiss, or flat out ignore. Most of us have been conditioned to think of a heart attack as that dramatic moment you see in movies, clutching the chest, falling to the ground. Yes, chest pain is a common symptom, but the reality is far more complex and often quieter, especially in women, older adults, and even those who seem otherwise healthy. A heart attack can present in ways that are easy to mistake for something else entirely. There's the pressure. Not always pain, sometimes just an uncomfortable heaviness in the chest, a sense that something is sitting on your rib cage. Some people describe it as fullness, like indigestion that just won't go away. It may come and go. That alone makes it dangerous. Because when a pain disappears, we're trained to think the danger has passed. But with a heart attack, a temporary pause doesn't mean the crisis is over. It could be the calm before a deadlier storm. Then there's the radiating pain into the left arm, sure, but also the jaw, the neck, the back, even the stomach. A woman may feel nauseated, lightheaded, short of breath, but never experience any chest pain. A man may feel extreme fatigue or break out in a cold sweat. These are symptoms that whisper, not shout. And when you're distracted, when you're stressed, when you're convincing yourself to push through the day, it's easy to miss them. And yet, this is your body's warning system. Think about that. Your body is trying to save your life. It's sending every signal it can to get your attention. But are you listening? That question brings us to something deeper, something more philosophical. Why is it that we so often ignore the very signs meant to protect us? Is it fear, denial, pride? We have this tendency to minimize our own pain, to see discomfort as a weakness. But strength isn't pushing through warning signs. Real strength is knowing when to pause, when to investigate, when to respect the quiet wisdom of the body. Because make no mistake, the body is wise. It knows when something's off. You may not be able to put it into words, but you feel it, that inner sense that something isn't right. We've all had moments like that. The trick is whether we respond or suppress it. That choice can mean the difference between survival and catastrophe. We also have to talk about timing. Many heart attacks don't happen when you're sprinting on a treadmill or running up a flight of stairs. They happen during rest. They happen in the early morning hours when hormone levels spike and the heart is under quiet, unseen stress. They happen during sleep. That's why knowing the symptoms and acting early is so critical. Waiting it out could cost you your life. And yet, time and again, people wait. They convince themselves it's heartburn. They lie down hoping it'll pass. They take an aspirin but don't make the call. Minutes pass. Cells die. Heart muscle is lost. That's the brutal truth of delay. A heart attack isn't like a broken arm. The damage it causes is permanent. The longer you wait, the more irreversible it becomes. But here's the part I want you to really hear. Recognizing symptoms isn't just about emergency response. It's also about long-term awareness. Those small episodes of chest discomfort that come on with activity and fade at rest, that's angina. a warning sign of narrowed arteries, that persistent fatigue that seems out of proportion to your activity level. That's your heart struggling to keep up. These aren't random annoyances. They're signals, clues, warnings etched into your everyday life. And every time you ignore one, you're turning down the volume on your body's emergency broadcast system. So how do we cultivate that awareness? It starts with attention, listening. Checking in with your body the way you check your phone or your inbox. What is your energy like today? How does your breathing feel? Is your heart beating in rhythm or skipping a step? Are you experiencing sensations that feel foreign, out of place, unresolved? This isn't paranoia, it's presence. And presence, in many ways, is the most powerful medicine you have. When you tune in to your body consistently, you don't just recognize a heart attack when it's happening. You begin to catch the patterns that lead to one. You interrupt the trajectory. You reclaim control. Because the heart does not fail without warning. It speaks softly at first, then louder, until the only question that remains is, were you listening? A heart attack begins in silence, but your awareness can be its greatest antidote. Don't wait to hear the scream. Respond to the whisper. Now let's step into the moment when everything changes, the actual heart attack. Not the buildup, not the warning signs, but the biological and emotional chaos that erupts in those critical minutes when the heart is under siege. Because this moment, although terrifying, holds a truth we often forget. The human body is built to fight for life. And yet, in those minutes, the clock becomes our most ruthless opponent. When a heart attack strikes, it's essentially a supply crisis. Blood flow to a section of the heart muscle is either severely reduced or completely cut off, usually due to a blood clot that forms at the site of a ruptured plaque. That clot doesn't have to be big, it just has to be well timed and in the wrong place. And when it happens, the heart muscle, deprived of oxygen, begins to suffocate. Now understand something important here. Your heart doesn't stop beating right away. That's a common misconception. What happens is far more complex. The heart continues to try. It adapts, it struggles. But without oxygen, the cells in the affected area start to die minute by minute. Within 10 minutes, damage has begun. Within 30, it may be irreversible. Within an hour, the risk of death increases dramatically. This is why time isn't just valuable in a heart attack. It's everything. The phrase, time is muscle, exists for a reason. The longer the heart is deprived of oxygen, the more tissue is lost. And that lost tissue doesn't regenerate. Unlike a cut on your skin or a broken bone, heart muscle doesn't rebuild in the same way. Scar tissue forms, weakening the heart's ability to pump efficiently. So we're not just talking about surviving a heart attack. We're talking about the quality of life that follows. Will you be able to walk upstairs? Will you experience fatigue doing the simplest things? That depends largely on what happens during those few frantic minutes. But what's happening emotionally in that moment? That's a question we don't ask enough. Because while the biology of a heart attack is clinical and measurable, the emotional reality is often surreal. Many people report an overwhelming sense of dread or disbelief. There's a surreal quality to it, like watching your own body from outside yourself. Breakfast, some describe it as a crushing weight, not just on the chest, but on the psyche. A primal realization that something is profoundly wrong, that the body is not in control. And this emotional storm is not benign. Fear triggers adrenaline. Adrenaline raises heart rate and blood pressure. That further stresses an already struggling heart. Panic makes breathing shallow, reducing oxygen intake when it's needed most. So your emotional response in that moment can actually influence the biological outcome. This is why training yourself to recognize the signs early, to breathe through the panic, to act decisively, calling for help, taking aspirin, staying calm, can make a massive difference in your outcome. This is also where preparation becomes a form of self-respect. Do you know what to do in the event of a heart attack? Have you rehearsed it in your mind? Not in fear, but in readiness. We prepare for so many things in life, career, relationships, even vacations. But when it comes to the event that could define the rest of your life or end it, we tend to look away. And let's be honest, many people wait too long because they don't want to be dramatic. They don't want to make a scene. They're embarrassed. But what's more dramatic than dying in silence because you didn't want to inconvenience someone? In that moment, your job is not to be polite, it's to be alive. There's also a larger philosophical insight here. A heart attack is the body's most aggressive plea for your attention. It doesn't whisper anymore, it roars. But that roar doesn't come out of nowhere. It's the echo of every ignored warning, every unchecked habit, every excuse to avoid change. And yet, even in that crisis, there's an opportunity, a moment of clarity. Survivors often describe it as a rebirth, a reckoning, a chance to start over with different priorities, different values. The body is telling a brutal truth, but within that truth is an invitation. Live differently. Because ultimately, what happens during a heart attack is a reflection of everything that happened before it. The food you ate, the stress you absorbed, the sleep you skipped, the signs you noticed but didn't follow. And if you make it through, you're given a powerful gift, perspective. The rare kind that isn't found in books or podcasts, but in the beat of your own heart as it stutters, then finds its rhythm again. A heart attack is a test of biology, yes, but it's also a test of awareness, courage, and choice. The question isn't just whether your heart will survive, but whether you'll truly live afterward. Let's turn now to something that often gets overshadowed when we talk about heart attacks. The recovery. Not the medical recovery per se, but the human recovery. What happens after the hospital lights dim, the machine's quiet, and you're left staring at the ceiling, wondering what just happened to you? Because a heart attack doesn't just wound the body, it shakes the soul. And how you respond to that, how you engage with life from that moment forward, may be more important than any surgical intervention or medication. Physically, recovery begins almost immediately. The heart is resilient in its own way. It tries to stabilize, reroute blood flow, and adapt. Medications support this process. Beta blockers, ACE inhibitors, statins. There may be stents involved. Cardiac rehab gets scheduled. It's a protocol, a structure. But inside that structure, there's something much more delicate occurring. The rebuilding of identity. People don't walk away from a heart attack unchanged. For many, it becomes a mirror held up to years of neglect, denial, or simply misplaced priorities. And here's where it gets interesting. Some people bounce back with remarkable discipline. They clean up their diet, reduce stress, start walking daily, but others spiral. They become overwhelmed, even paralyzed by fear, or slip into habits worse than before. Why the difference? It's not physiology, it's psychology. It's mindset. See, a heart attack redefines your relationship with your body. Before, the body was an obedient servant, mostly silent, mostly dependable. But now it feels unpredictable, even treacherous. Every twinge in the chest, every skipped beat becomes a potential threat. Some people start living in constant anticipation of another attack. And that fear alone can trigger anxiety, insomnia, and yes, more cardiac stress. So the real work in recovery is rebuilding trust. Trust in your body, trust in the path ahead. What helps here isn't just medication, it's meaning. It's having a reason to wake up with purpose, to move with intention. I can't count how many patients I've spoken with who say, I never thought about what mattered until I nearly lost everything. That's the awakening. And you can build on that. Recovery isn't about returning to your old self. It's about becoming someone new, someone wiser, more aligned. You start asking different questions. What brings me joy? Who do I want to spend my time with? Why was I chasing things that didn't matter? That kind of clarity doesn't come from books. It comes from a confrontation with mortality. A heart attack is one of the few events that cuts through the noise of modern life and forces us to listen deeply to what's been neglected emotionally and spiritually. Now, on a practical level, this means making lifestyle changes that actually stick, not the kind you do for 2 weeks and abandon, but the ones rooted in self-respect. Eating better isn't a punishment. It's an act of devotion. Moving your body daily isn't a chore. It's a celebration that you can. Managing stress isn't about being soft. It's about being strategic. Your nervous system is wired for survival, but it's not designed to be under siege for decades. Chronic stress inflames the body, stiffens arteries, and triggers hormones that erode health. So yes, meditation, breathing, gratitude. These are not just buzzwords. They are biological tools for healing. And let's not forget the role of connection. Social isolation after a heart attack can be just as dangerous as a poor diet. Humans are wired for community. If you feel alone in your recovery, you're more likely to fall into depression, skip medications, avoid exercise. But when people feel supported by family, by friends, by a cardiac rehab group, they heal faster and more completely. Recovery is not a solo journey. It's a shared one. But the most important part of this whole process is mindset. You're not a victim of your heart, you're the steward of it. And every day, you're writing the next chapter of your health story. You can choose to write it in fear or in empowerment. You can focus on what went wrong or on what could now go right. The choice is yours. So I'll leave you with this. A heart attack is not the end of the story. It's the beginning of a new one. One where you're finally awake to what matters. One where your body isn't your enemy, but your partner. One where you move forward, not in fear, but in wisdom. Because the strongest hearts are not the ones that never break, but the ones that learn how to beat with purpose after they do.